These are very simple, gentle movement exercises, and sometimes the body just needs simple, gentle movement. These are exercises I do every night. They include motion in the feet and ankles, knees, hips, pelvis, sacroiliac, lumbar spine, and even movement up through the whole spine. Now, this is my red ball, exercise ball. It's a little tall for Karen. Ideally, the height is such that your knees are bent at a 90-degree angle. And her knees are bent at about, well, they're at least 15 degrees above that. So keep that in mind. You can measure with a tape measure the distance from the floor to the back of your calf when your knees are bent 90 degrees and hips are bent 90 degrees. Now, you want to keep a little bit of space between the ball and you and your thighs. So Karen, go ahead and move the ball away from you. Okay, and bring your feet forward towards you. Okay, ball goes away from you a little bit more. Okay, a little bit more. Okay, now we've lost the angle in your hips, so bring your knees up towards you. Towards you, keep going, keep going, keep going. That's our neutral position. So we always want this 90-degree angle in the thighs. Okay? So the first exercise is gently sliding the knees up towards your chest. Very gently. And I recommend 10 reps for all of these exercises. And it's just whatever small, smooth, easy movement, that which feels natural. We're not pushing, we're not trying to stretch. What you'll notice if you do them very gently, you'll notice that by the time you do 10 of these, you'll notice that you've gained range of motion. So just very gentle. Good. And then we always come back to the neutral position, so bring your knees up towards you. Good, and stop. Okay? And now what you're going to do is you're going to keep your knees together, feet together, and you're going to let the knees drop out to the right side. Good, so they just fall out to the right. Go ahead and do 3 of those. And then when you're done, do 3 the other direction. Very good, and then do 3 to the left. Good. And then we come back to neutral. So now she's going to bring her knees up towards her chest till the thighs point straight up a little bit more. Good. Excellent. Good. Now you're going to keep your knees and your feet together. And this one's a little bit challenging, and there's definitely less range of motion available. You're going to go obliquely. So both knees are going to go towards the outside of your right shoulder. Good. Do 3 of those, please. It's an oblique movement at about a 30-degree angle outside of the right shoulder. And then when you do 3, go ahead and do 3 to the left. Very nice. Straighten out. Good. Come back to neutral. So you're going to bring your knees up so that your thighs point straight up at 90. Beautiful. Stay right there. Now, do not push any of these exercises. Stop if any of them cause the slightest soreness. Sometimes if it's tight going in one direction and uncomfortable in one direction, sometimes emphasizing movement in the opposite direction can be helpful. But for folks who have femoral acetabular impingement, if some of you have some hip pathology, some of these directions might not be tolerated. And that's true for pathology in the SI and in the lumbar spine as well. So just go with what movement comes easily. Okay? So she's going to keep her feet together, knees together, and now she's going to do circles. Okay? So she's making gentle circles with her feet, going counterclockwise 3 times, and then she'll come back to the neutral position, and then now she's going to do clockwise. Okay? And again, I like 10 reps for each of these, but for demonstration we're just going to show 3 of these. Very good. All right, come back to neutral now. Okay, this is my absolute favorite exercise. I think it's really good for all of your lumbar facet joints, including where L5 connects to S1. And what you do is you straighten out your knees. Good. And then what you're going to do is you're going to keep your knees and your feet together, and your feet are going to roll over to the right. Good. So give me 3 of those. And I like to keep it in one direction rather than going right, left, right, left. I like to just go to the right and then to neutral and then repeat 10 times. So good. Then she's going to the left. And we're just demonstrating 3 of these. And after you view this video once or twice or 3 times, you'll remember all of them. Good. So come back to neutral. And now you're going to put your left foot down. So you can keep your left knee bent, but put your foot on the floor. Okay? We're only going to demonstrate this on one side of the body. So we're only going to demonstrate it with the right lower extremity. So now you're going to bring your right knee towards your chest. Just roll it towards your chest and then back to neutral. Good. 3 times. Good. And then come back to neutral. Stay right there. Okay? Good. And now you're going to let, no, not the knee. Oh yes, the knee. It's the knee that falls out to the right. So it's called a dropout. So the knee drops out to the right. Good. And come back to neutral. Sorry, bring the knee to the left. So your thigh is pointing straight up. Good. Now out to the right again. Drop out to the right and come back. Out to the right. Come back. Beautiful. Okay. Now you're going to do circles. To the left, yeah, do circles. So she's going counterclockwise 3 times. And then we're going to do them clockwise. Good. So now she's coming back to the starting position. So thigh points straight up towards the ceiling. Good. Stay right there. Beautiful. And now you're going to do the oblique one. So now you're going to bring your right knee to the outside of your right shoulder. So it's about a 30-degree angle. So if you could go all the way, you would touch the outside of your shoulder. It's about a 20 to 30-degree angle. Good. Excellent. Good. Now the last one, you're going to straighten out your knee. Okay, so knee is straight, and now you're going to bring your foot, it's going to roll out to the right. And I think what we'll do, I think we'll go ahead and film these on the other side as well, and that way you could listen to the video and do 3 practice ones to build a memory of these exercises. Excellent. So now you're going to bring your left foot up on the ball. Good. Keeping that 90-degree angle. You're going to put your right foot on the floor. Good. So now you just rock the ball. Bring your knee towards your chest. Good. Straight up towards your chest. Good. And I know in the camera view it looks like it's pointing outward, but it's not. Let me come get a different angle for you. Good. Do a couple more. Just straight up towards your chest. Excellent. Good. Go back to the neutral position. And now you're going to do dropouts. So your knee is going to fall out to the left. Yeah, good. And yeah, the foot follows it, but you image the knee going outward. Excellent. Now you're going to do circles. And these are my second favorite one. Good, but slow it down next time, and now we're going to do the other direction and just do gentle, slow circles. Yeah, and they're small. They start out small, and just naturally your body naturally increases the motion. It relaxes into the movement. Okay? Good. Come back to neutral. And now what you're going to do is straighten out your knee. Okay, good. And now the foot is going to drop out to the left. So it just rolls out and comes back to neutral, and do 3 of them. So we did the second filming from a different vantage. The first filming was done a little bit obliquely, a little bit of a side view, and now we're filming you know, top down. And so I hope that's helpful to get those 2 views, and hope these are helpful to you. Thank you.